Thank you, Chris, and thank you to the members of the media for joining us this afternoon. I know it's been a busy morning for many of you. About a month ago, we paused our weekly COVID-19 media briefings as many newsworthy topics, including vaccine mandates, start of the school year, and availability of booster shots were behind us. We've invited you to join us for a briefing today because we've seen a rise in hospitalizations that is affecting hospitals and healthcare providers across Maine, and we want you to understand where we currently stand. Thank you for joining us today and helping to provide credible, timely information to the community. As always, I'll start with some current numbers. As of this morning, we are taking care of a total of 98 patients as inpatients across our system. 15 of those are at A.R. Gould Hospital. 1 is at C.A. Dean Hospital. 46 are at Eastern Maine Medical Center. 6 at Inland Hospital. 7 at Maine Coast Hospital. 4 at Mayo Hospital. 12 at Mercy Hospital. And 7 at Sebasticook Valley Hospital. In addition, we are caring for 14 patients for COVID-positive symptoms at home through our home care and hospice service. Our 2-week positivity rate stands at 18.86% with a 1-week positivity rate of 19.45%. We also have available our most recent COVID-19 hospitalization graphic. The numbers continue to show that those who are vaccinated have lower cases of hospitalization and severe disease. As we've noted before, this graphic represents a snapshot in time and the data is constantly changing. The graphic, which included data compiled yesterday, can be shared in the chat. Our Northern Light Health COVID-19 positivity rate is nearly 20%, meaning that 1 in 5 of the tests that we perform are positive for COVID-19. That's higher than it has ever been. Given this, it is not surprising that hospitalizations are also rising. The impact of COVID-19 is widespread. Earlier this week, every Northern Light hospital except for Acadia Hospital was caring for COVID-19 inpatients. As a system, we are at a critical point, and it is starting to affect patient access for elective care at some locations. That said, some areas of the state are seeing higher infection and hospitalization rates than others, especially in our rural areas. For example, Aroostook County has been a hotspot for the past several days. A.R. Gould Hospital in Presque Isle has more COVID-19 inpatients than all of our other hospitals except for Eastern Maine Medical Center. Next week, there may be a new hotspot. The high number of hospitalized patients across Maine has led to capacity constraints statewide, including at Northern Light Health hospitals. Since the early days of the pandemic, we've mostly been able to avoid postponing non-emergency care and temporarily closing services. But with the rise in hospitalizations, as well as a steady stream of non-COVID patients who may have delayed care in recent months, the current situation is more critical than it has been at any point in the pandemic. While no significant changes are imminent, we're prepared to take additional steps if needed to ensure that our sickest and most vulnerable patients get the critical care they need. There are several things that we continue to do and something the community can do to help. First and foremost, getting vaccinated remains the most important thing that Mainers can do to reduce the impact of COVID-19. As of this morning, more than 3/4 of our hospitalized patients are unvaccinated. Most vaccinated patients in our hospitals received their vaccines more than 6 months ago. That's why we continue to encourage vaccination for those who have not yet been vaccinated and booster shots for adults who received the Pfizer or Moderna vaccine more than 6 months ago or a Johnson & Johnson vaccine more than 2 months ago. That data is very clear. The vaccines make a difference. Our hospitals continue to be nimble and use their resources in the most effective ways possible to care for the most seriously ill patients. This means that sometimes non-emergency procedures may be postponed. This varies by hospital and can change day to day as new hotspots flare up. Specifically, starting on Friday, non-urgent procedures at Eastern Maine Medical Center will be evaluated for necessity, with some needing to be postponed if there is a high likelihood of needing admission to the hospital. Patients will be notified individually if their procedure is being delayed. EMMC staff are working to make this temporary measure short-lived, and we appreciate our patients' understanding. We continue to work closely with the state's other hospitals and healthcare systems to coordinate care and do whatever we can to ensure that patients receive the care they need, even if it means being transferred to a hospital that is outside their region and in rare cases, even outside the state. While beds are in short supply, the state's hospitals and healthcare systems are maximizing our capacity by working together. Unfortunately, a shortage of skilled and long-term beds across the state adds to a difficult acute bed situation. While we've done the background work needed to set up alternate care sites, we do not anticipate activating them in the foreseeable future. Our goal is to continue to manage care during this phase of the pandemic in our hospitals. Rest assured that despite these challenges, we continue to work hard every day to meet our patients' healthcare needs. As I've already stated, the best way for the community to help at this point is to get vaccinated. I do want to talk a little bit about the Omicron variant. There have been a lot of recent questions about that variant, so I'd like to spend a few minutes discussing what we know. No cases of the Omicron variant have been confirmed in Maine, but it's inevitable that it will arrive here if it hasn't already. Scientists are still learning about the Omicron variant, and it's been reported that the Omicron could be more transmissible but less virulent, but is still too early to know. We've heard rumors that some people are relying on being exposed to the Delta variant to safeguard themselves against Omicron. There is no guarantee that having been infected with the Delta variant of COVID will provide any protection from this new variant, and as we have seen, the Delta variant itself can cause very severe illness or death. It is a booster or vaccination to be the best way to protect yourself from COVID and any of its variants. Omicron doesn't change anything in terms of our preparedness and response and our advice on vaccination. We continue to monitor the science, and as we understand the potential impacts here in Maine, we will have more to share as time goes on. And with that, I'll turn it back to Chris to start our question and answer period.
Okay, thank you very much, Dr. Jarvis. We're going to go through our list, and first up is going to be Jim Keithley from WMTW. Jim, you should have the ability to unmute yourself now and ask your questions.
Thank you, Chris and Dr. Jarvis. Coming off the previous press conference with Maine Health, I can't help but notice the difference, I guess.
Oh, Jim, I'm sorry. Give me 1 second to unmute you. I did that by mistake. Jim, unmute yourself and ask your questions again. Sorry about that.
That's all right. Coming off the similar press conference that Maine Health just held, sounds like they're in a little bit worse situation than you are, especially Maine Med saying basically they're out of room. My question to you, it sounds like you have some availability, and I'm curious, the relationship, say, between Maine Med and Mercy, obviously being in such close proximity, if people would or needed to be shifted down to the Riverside Hospital, is that something that is being done, can be done? I guess I'm just thinking contingency plans if and when your hospitals become basically maxed like the rest.
Yeah, that's an excellent question, and it really gets down to the fact that Maine's own statewide healthcare system is certainly fragile, and any one area that sees stress puts stress on the rest of those areas. As I said, and as was mentioned at the Maine Health press conference, we work collaboratively on a regular basis. We speak every morning to kind of share where at least the four main medical centers in the state are at a given time and where we see stress points within our own health systems. It is true that Maine Medical Center and Mercy Hospital work very closely together, and if one has an area of critical need, sometimes the other can pick up on that, but sometimes it's something that overlaps, and really we are seeing that now. As I said, Mercy Hospital has a significant number of COVID positive patients as well, and both hospitals in the Portland area certainly are seeing an increase in number of patients for non-COVID related reasons as well. Again, one of the fortunate things that we have here in Maine is that we are collaborative across our health systems, and we work very well with state agencies to improve the care and the livelihood of people in Maine, and we will continue to do that. But when we see that a stress happens at a large hospital like Maine Medical Center, it's certainly going to affect other hospitals, and we're certainly seeing that at Northern Light Health. We are not quite to the same point that Maine Health is in terms of curtailing procedures or delaying them for a period of time, but that may happen on a case-by-case basis due to the stress that our own health system is seeing. So thank you for that question.
Just a quick follow-up, Maine Med saying about the non-emergency operations or surgeries, rather, they are going to postpone them and basically transform a half a dozen operating rooms into rooms to accommodate the overflow here with the COVID patients. And I wonder how you've been able to avoid doing that.
Really, the reason why we've been able to avoid it, it really has to do with the regionality of where we see hotspots in terms of COVID-19. That's one of the reasons why, and at the present time, Eastern Maine Medical Center has been able to manage that caseload. Again, as I said, as of Friday, they will start to assess all non-urgent procedures to see if they can delay, in particular, ones that may require hospitalization. Right now, it is not in our plans to curtail non-urgent procedures that can be done on an ambulatory or outpatient basis. But of course, that could change depending on where our status is in the coming days and weeks. One of the other things that both Maine Health has noted, as has Northern Light Health, that our smaller hospitals are now capable and able to take care of more patients who are positive for COVID-19, thus somewhat spreading out that particular stress to our system, and rather having all of those patients located at Eastern Maine Medical Center, or in the case of Maine Health, Maine Medical Center, we have been able to see that we can have patients stay closer to home, which has really been a value to both the communities and those families of patients who are afflicted with COVID-19. But however, there's only so much each hospital can do, and once you hit a tipping point, again, that stress gets spread not just over our own health system, but the entire state's health system. So thank you again for that question.
Thank you very much, Jim. I'm going to move on now to WVII Fox Bangor. This question is from David Horowitz. He doesn't have audio, so I'm going to ask it for him, Dr. Jarvis. His question is around capacity and if Northern Light is experiencing the same issues as Maine Health. I think you addressed this already, but why don't you address it briefly again for Mr.
And again, it bears repeating. While we are not to the extent that Maine Health is currently seeing, mostly because again, one of our big hotspots is in the southern part of the state for patients positive COVID-19. We are seeing just below that level. It would not take many more patients needing to access care for us to start talking about similar stresses that Maine Health is experiencing right now. And certainly, as a collective group, we will attempt to help each other out in order to lessen the burden in any one particular area or one particular health system.
Okay, thank you. And now we have Hannah Deneen from New Center, Maine. Hannah, you should be able to ask your questions now.
Hey, thanks, Chris, and hi, Dr. Jarvis. So my question is, in the Maine Health meeting earlier, we talked about how this issue of the bed shortage does have the potential of getting more severe as we head into the holidays. If we reach the point where we're quite literally running out of beds in the state, what is that plan? Is there any plan to reimagine those overfill sites that we had spoken about at the beginning of the pandemic?
Yeah, so Hannah, that's a great question, and the issue there comes. The plans still exist for all of us to be able to set up additional care facilities. The issue there becomes staffing. At the present time, we need more staffing just to manage the patients we have in our hospitals, and particularly in our skilled and long-term care facilities, which, because they're unable to take patients who no longer need to be in a hospital but are not yet ready to go home, that is the other issue that we have with our hospital beds being filled up. So really it comes down to those alternative care sites. We wouldn't have the staffing currently to be able to man those. What we would have to do is readjust where we are locating our patients, particularly those that are in that subacute phase, who no longer need to be in a hospital but really need to be in a skilled or nursing or long-term care facility, in order to open up beds for more acute conditions. We can certainly talk about other avenues for us to do that. You heard Maine Health talk about today maybe converting some of their OR space into intensive care space, and certainly we have flexibility within our system to do something similar to that. We are trying to do everything we can that we do not get to that point, but I think we were a long ways off from talking about alternative care sites.
Okay, and Hannah, do you have a follow-up question?
Follow-up question was exactly that, whether staffing would be an issue as well. So thank you for addressing that.
Yeah, and that's staffing not just for clinical workers, but for all of the non-clinical roles that have to get played there too. We need to have environmental facilities staff, need to have dietary staff. All of those other things would need to be in place too, and we have shortage across all of those across the state of Maine currently.
Okay, thank you very much for those questions, Hannah. And next up, we are going to go to Ellsworth American, Rebecca Alley.
Yes, hi. Thank you all for your time. My question was actually also about staffing. So thank you for addressing that. Is there any plan, I guess, to try to gain staffing from other states or other, is there a plan to staff facilities at the moment?
Yeah. So this is Paul. I can answer that. I think the issue, really is very complex. There's a nationwide staffing shortage, not just in the healthcare sector, and there are a number of factors that make Maine a very competitive environment for staffing. We've had great success in recruitment efforts. We've been very dynamic in our changes to our offerings to employees, whether it's sign-on bonuses or other inducements to encourage people to become part of Northern Light Health. Last month alone, we hired 239 new external people to Northern Light. And so it's a matter of getting the right folks in the right place at the right time with the right skill sets. And so we know there's not enough labor pool availability in the state to meet all of the healthcare needs for Northern Light Health, Maine Health, and all of us combined. And so we need to bring in people from outside of Maine. And that continues to be part of our strategy in recruitment, is to use as necessary traveling clinical workers, whether it's nurses, physicians, respiratory therapists, and others. That's a critical part of our ability to flex to meet this demand. But those workers are in high demand and are scarce in the national market. So it's a very challenging and dynamic situation. Our staff have just been fantastic throughout this and have been very flexible in the assignments they're taking. We have administrative employees assisting with patient food delivery in times, or are doing health screening for patients and visitors coming through in ambulatory settings. So it's a combination. It's not an easy answer. And staffing certainly is a concern. It's a concern of ours. The state has been very helpful in terms of intermediate and long-term staffing needs, but what we need today is, it's harder to find the staff available to meet those needs. And certainly we're doing everything that we can to meet those needs. We've been very successful up to this point. We think we'll continue to be, but it's really a very delicate situation.
Okay, thank you. Rebecca does not have a follow-up question, so we are going to move on next to Patty White from Maine Public.
Thanks very much. Can you describe a little bit more about what the capacity constraints look like on the ground, Dr. Jarvis? Are you needing to board patients in the ER, or has EMMC had to divert patients? Tell us a little bit more about what it looks like.
So over the last few days, EMMC has not needed to go to divert a large number of patients. Sometimes there are patients that, due to because of their acuity or what their needs are, we do have patients that we transfer or have go around us to other organizations, and that just happens. That has nothing to do with the pandemic or capacity issues. That just happens. As far as capacity goes, most of our hospitals across Northern Light Health are boarding some patients within their emergency departments, some with higher numbers than others, AR Gould in particular, EMMC in particular, and that's a concern. EMMC currently today is really discharge dependent as to what patients they can accept from within the region to come to EMMC. We prioritize those that need urgent procedures that can only get done at an institution like Eastern Maine Medical Center, and those that need critical care. We do try to support our smaller hospitals with the patients that are being boarded in their emergency departments. We have a tele-ICU service set up that a provider at a small hospital can contact a provider with more experience and skill in dealing with intensive care patients, and therefore provide them with the necessary information and tools to take care of those patients, so we feel comfortable that the care that our patients are receiving, even if they are boarding in one of our emergency rooms, even at a small hospital, is the appropriate care for the time that's happening. And we prioritize based on acuity and need, and then of course bed space. So there's a strain there, and the things that we ask your viewers and listeners and readers to understand is they can help us. They can help us by trying to remain well. And the single best way you can prevent getting COVID-19 is to be vaccinated. If you are fully vaccinated and you're eligible for a booster, get your booster. And by all means, please wear a mask while you are out in public. and stay home if you're not feeling well. We cannot have any more spread of this disease because it will overwhelm our healthcare systems. And then you will be talking about having no place for a patient to come when they do have that urgent need. And we do not want to see that happen. So thank you.
Thanks. If I could ask one more quick question, in terms of postponing non-urgent procedures, even though it's going to be on a case-by-case basis, do you have a ballpark of what you're expecting to postpone, 10% of surgeries or anything like that?
Yeah, Patty, we don't have that at this moment because, again, for us, it's going to be a relatively small number. We're probably going to be talking about cases of individuals who are talking about particular joint replacements or spinal surgeries or other high-tech procedures that may require them to have a hospital stay post the procedure being completed. And right now, because of bed capacity, that's the reason why we're looking to see if we can postpone or delay some of those cases. We will try to make sure that any case that we feel is deemed necessary in order to improve or maintain the health of an individual, we will prioritize those cases. Right now, it's a little bit too early to tell the number of cases that will be affected by our current bed situation. And of course, as I said, that's completely tenable if we see an increase, and even further increase in caseloads, we'll have to alter that plan and may need to postpone even additional surgeries. So, Patty, thank you for that question.
Thank you, Patty. And next we're going to move to WABI. Owen Kingsley, you're up next.
Dr. Jarvis, I don't think this has been asked yet. Can you just speak to some of the concerns you maybe have with Christmas holiday coming up? New Year's, what are the concerns with Omicron spreading around the country, concerns you may have about hospital capacity coming into the new year?
Yeah, well, if last winter is any indication of what this winter will be like, it was after the December holidays and into January that Eastern May Medical Center in particular saw its greatest number of patients being admitted day after day, and we do not want to see that again. We have another confounding thing, not just from COVID-19, but this year we have influenza to deal with. Last year was a very low rate of influenza across the state, but we see cases ticking up. And so again, this is another plug for people going out and getting their influenza or their flu shot vaccine, because that will help prevent us having to have a double whammy of treating patients with COVID-19 and treating patients with influenza, both of which can be serious and life-threatening conditions. And so that is where the concern is, and we continue to have that, and we continue to monitor it. We know that during holiday seasons, people do get together. I know it's difficult for people to have conversations, but you really want to have this conversation with your family. If people are not feeling well, it's not the time for them to come out and have that celebration in a big group setting. Think about the other members in your family. Are there people who are particularly vulnerable to severe respiratory disease from either COVID-19 or influenza? Those that are being treated for cancer, those who have major health conditions, the very young or the very old, and maybe it's time, this is not the time to get together, particularly if there's anybody in the group who is not vaccinated. Things that you can simply do during those holiday sessions if you do get together, insist on people wearing masks. It's a simple ask for us. We're asking you to do it when you're going shopping. And then if you are going to have a meal together, make sure that you're spaced far apart. So those are some good advice for anybody who is going to have a gathering. But the most important thing is if anybody in the family is not feeling well, please have them stay home. So thank you for the opportunity to address that.
Thank you. And Dr. Jarvis, one other thing, more of a clarification. You mentioned that non-COVID patients are also on the rise. Could you clarify what non-COVID areas of the hospital you're seeing a rise in patients? Is that people who are in need of emergency care, or is this more of a backlog of people who've put off elective surgeries?
Yeah, it's actually a combination of both of those things. And so there's no particular, other than COVID-19, there's no particular illness or condition that we are seeing right now. It is really a kind of a widespread issue, and it does involve both people with just acute care things. We have had an increase in car accident and trauma-related admissions as well over the last few days, as we know that roads have been slippery and the like. And then we are seeing some patients who delayed care, and therefore their condition, which may have been something easily managed or less complex before, is now more complex and requiring a longer hospital stay. And so all of those factors, coupled with the fact that we have very limited beds available in our skilled and long-term care facilities for patients to get discharged to, all of that just adds to the stress on our overall bed capacity, across not just Northern Light Health Systems, but across the entire state of Maine.
Thank you for your questions, Owen. We have Spectrum News. Susan covers that her questions are already answered, so we're going to move on to Blair Bess from WGME. Blair, you should have the ability to unmute now.
Perfect, thank you. I really just have one question here. What do you think it will take to slow the spread of this virus and as a result, increase capacity in hospitals? I mean, there continues to be these briefings, there's vaccination clinics all across the state, yet we're still seeing record hospitalizations almost daily at this point.
Yeah, all I can talk about is good public health measures. I can't talk about anything, in regards to are there things that the state should be doing or the federal government should be doing or anything along those lines. So for me, it really just gets down to, as Mainers, we care for one another. We have always taken care of our own, and we need to continue to do that. The single best way that you can take care of your neighbor, your friend, your family members, and your community is to get vaccinated if you aren't yet vaccinated, and to get your booster shot if you're eligible for your booster shot. Wash your hands frequently, stay home when you're not feeling well, and wear a mask when you're in a public location, particularly indoors. Those are the strategies that we've been saying for almost 2 years now, and we know they work because in areas where they have done this widespread, they have kept things under control. The problem is everybody has to do that. If you have one person that's not doing those things, they become the weakest link. They become the focus for the next outbreak, the next mutation, the next variant, and we don't want to see any of that. We all have to participate. This is a community-wide effort, a statewide effort, a nationwide effort. We all have to do our part, and the best thing we can do is to get ourselves vaccinated.
Thank you.
Okay, thank you for that question, Blair. And next up, we're going to go to Dustin Witkowski from NBC Boston NECM.
Thanks, Chris and Dr. Jarvis and everyone else on the call. I put this question to Maine Health. If we had an event like a building collapse, a bus or train accident with 100 or more critical injuries, could Northern Light Health handle that right now, given the capacity constraints?
Yeah, we would do everything we can to respond to any major event and situation, and that's what acute care hospitals are designed to do. And we do have our emergency preparedness plans in place, both at Eastern Maine Medical Center and across our health system. And we would activate that and do the work that has to be done. In order to do that, however, we would start talking about curtailing more than just elective cases or non-urgent cases that would require hospitalization. We would start talking about curtailing those services for outpatient procedures as well, and looking at things like having to curtail of other ambulatory practices in order to meet the needs of what would probably result in a lot of inpatient care. That's where we're at right now. We don't have that flexibility that we typically would have to respond to a mass casualty event or a mass illness event because we're in the middle of a mass illness event. And so that would add just another layer of stress. But I am confident that our doctors, nurses, and staff across the entire system would stand up and do whatever we could and whatever is needed to continue to take care of our fellow Mainers.
Now, from various places I've read this, it sounds like Penobscot County has an acutely high level of COVID or COVID hospitalizations compared to other regions around the country. Is that what you're seeing? I mean, what does it look like on the ground there, if you could put it in a region by region context?
Yeah, the issue there is really kind of, it shouldn't be looking at the county. The matter there is that Eastern Maine Medical Center is the regional referral center for the state north of Augusta. And so that's a very, very large geographic region encompassing many of our most rural counties, including several of the counties that have the highest case rates at the current time. And because of that, it makes Penobscot County look artificially high in terms of its hospitalizations. Because we take referrals not only from Northern Light Health hospitals, but from all of the smaller hospitals in the northern part of the state, it makes EMMC's numbers look a little bit inflated. But we see that day in and day out. It is not the COVID pandemic that has brought that on. That's just the nature of the fact that Eastern Maine Medical Center serves a 500,000 plus population scattered over a geographic area as large as the rest of New England. And so that is actually just a normal thing for Penobscot County to have a higher rate of hospitalization capacity than most other places. It's the uniqueness and the challenges of the geography of Maine.
Thank you very much for those questions, Dustin. We're going to move on to Bangor Daily News. David Marino, you're up next.
Sure, thanks. Dr. Jarvis, you mentioned earlier that the Crescent Insurance Center might not be possible with staffing, but is it? I mean, could this, if Eastern Maine Medical Center was completely overwhelmed, would you at least look at that? You said that you weren't really there yet, but is that a possibility whatsoever if this gets much, much worse?
It's always a possibility. Those who have heard me speak before know that taped to my whiteboard is the actual plans for what we would do in the event that we needed to open up an alternative care site. I leave it there so that it's always in the back of my mind and easily seen by me to think about that as a consideration. But at the present time, Northern Light Health does not think that is anywhere as near where we are at as far as the situation goes. We would certainly be open about those discussions should we ever get to that point in time. I am hopeful that will not happen. I think that we are able to manage, even with the current surge, to manage things in our acute care hospitals like we should do. We still feel that the best place for people to get acute care is in an actual hospital setting and not in an alternative care site. And in fact, as we talked about before, our original plans were not to use the alternative care site for acute care, but really for convalescent care. If that came to pass, we would certainly be talking about it widely before we ever had to activate that particular plan.
And my second question was, you've talked previously about the amount of unvaccinated rural residents that your hospital system sees. Would you say that, right, in terms of COVID patients, would you say that still remains the case, that the good, the majority, if not a very substantial amount of the people being hospitalized for COVID are rural people who are unvaccinated? Yeah,
that still continues to be the case. If you actually look at the graphic that we displayed, as of yesterday, we had 105 patients who were hospitalized. Only 22 of those were unvaccinated, and of those that were ventilated, only 1 of the 10 ventilated patients was vaccinated. So this clearly states that unvaccinated individuals are still the majority of people who are getting sick and getting sick with severe illness and requiring critical care. And so that's important to say. And then when we dive down into actual zip codes of looking at admissions, it is still the majority of people are coming from our more rural counties.
Hey, thank you for your questions, David. Last but not least, John Richardson from Portland Press Herald.
Thank you. You may have answered this earlier, I apologize, but can you give some specific examples of procedures that will now be delayed at EMMC and what procedures are going to go forward but potentially could be affected?
So currently at Eastern Maine Medical Center, the surge plan for our operating rooms would allow us to continue to perform surgeries that would be done on an outpatient or ambulatory basis. So we will continue to do those and do not expect that we will need to curtail those. The procedures that we will look at, whether we need to delay or postpone, will be things where they are procedures that have a high likelihood that the individual would need to be hospitalized afterwards. Those tend to be things like joint replacements, spine surgeries, and some other complex things. Again, nothing that needs to be done urgent, but these are still things that affect people's livelihoods. They affect the way they are. These are not things that people are getting done just because they want to get them done. These are things that need to be done. So every day that we delay those, that's impacting somebody's life. And so again, thinking about that community aspect of things, you don't want to be the person who gets admitted to our hospital for COVID-19 who then delays somebody else from doing something that's so important to them that it may affect the way they work, the way they live, the way their family life is. And so again, trying to decrease the number of admissions that we have for COVID-19 will assist us in then not having to worry about whether we would have to delay or postpone any particular type of procedure.
Okay, and John, do you have a follow-up question?
No, I'm good, thank you.
Wow, great. Okay, well, it looks like we've made it through a very long list of media partners. Thank you very much for joining us here for this virtual media advisory. Again, if you want a high-resolution video copy of the press event, please indicate so in the chat box before you leave. Other than that, I'll say goodbye, and Dr. Jarvis and Paul, I'll let you say any last words if you'd like.
Yeah, I want to just, again, thank you all for joining us and helping to share our important message out there. Things can get better. We can all assist in making things better, and we need that assistance now. Wash your hands, wear your mask, stay home if you're ill, get vaccinated.
Thank you.